Health Education Lecture Series. All listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568. Phone number 408-687-1899 and email address homeomedicine HOMEOMEDICINE at yahoo.com. So anytime when you're suffering from any disease at any age and tired of all treatments, please call me for your second opinion of your disease and treatment. Wherever you are getting treatment, it's okay. But you can just get a free consultation with me so that you can come to know that what way your treatment is going on and why you are not getting improvement, what may be the cause behind that. So all these things on a natural basis, how this body works, I can guide you according to that. In this way, since many years in USA, I'm delivering all these lectures for the benefit of the public so that my public should be aware of this health, this body structure, functioning, and if ever it falls sick, he should be aware of that what are the causes behind it, what may cause sickness in any disease, so that beforehand, or even if you suffered from something, you must know that these are the causes behind this disease, and I have to take those back. And if ever you take up back to those causes, definitely the disease, since at that moment, since very day, will start backing up, improving, you can say. It may take longer time. It may be that your age is not giving us sufficient times. It may be that the severity of the disease may not give us the proper time, but at least when you know the causes of the disease and you withdraw those causes, ultimately it starts aggressive nature of the disease. It starts aggressive progress of the disease. In this way, from the same moment, when you avoid those causes which are you think responsible for producing the disease symptoms are removed, and you back up with that one. So in these lectures we are giving details of this body, how this life was formed, how this life was developed at different places in fallopian tubes, in mother's womb, and ultimately when it comes out of mother's womb, how it was developing. Complications during mother's womb period, that's 280 days, and the complication when it comes out of mother's womb, that is the labor. Everything has been described systematically in these lectures one by one. If ever you are not aware of those things, that you have not listened to my those lectures, you can go to my YouTube channel, Homeopathic Natural Medicines, and you can all those lectures you can learn one by one whenever you have time, any times, so that you can be aware of all those things. When the life starts, how it develops, where it develops, and what happens with the developments, what are the problems that a child is not developing in a normal condition, structures and everything. So you can go through those lectures and be aware of those things so that you have a knowledge about your body. Ultimately, I have described about the basic unit of this body, that is the cell, because this whole body is made up of trillions of cells, and trillions of cells have one thing in common, that is the structure. A cell is having a definite type of structures in it, and all the structures inside the cells are having their definite work or duty they perform. And when all the organelles inside the cells, and all the cells, the trillion cells in different systems, different organs, are performing the normal duties, the normal life is produced. But if somewhere, by some reasons, is not doing its duty normally, at that conditions, a person may suffer from sickness, disease. So that disease, now we are at the area that we have to describe the disease. We have described step by step the life from beginning to up to the adult age. And when it reached to the adult age, we assume the most of the things which were supposed to be structured, and those, well, some of the people are calling at this time, and sometimes I'm unable to answer because when the lecture is going on at this time, I cannot pick up or I cannot check the messages. So please call me after the program is over from 5 to 6. After 6 p.m. of California Pacific Standard Time, you can call me and I will answer your questions. So, second thing, we assume at the time when the body is structurally adult, and when it is structurally or age wise, we consider it adult, we assume that all these structures have been formed, whatever is required. But even then, I have given you some examples that this structurally formations, changing into different structures, changing into their different formations, continues till the end. As far as we know, up to that one, we know that just like the teethings. I give you the examples in my previous lectures. I can repeat it so that you can understand this thing, that we assume the first teeth starts erupting at the fifth or sixth month of the newborn age. And after that, 20 teeth are completed up to 2 years of age, means 24 months at different periods. And ultimately they start breaking of these teeth starts same way as it was on the month, but now the breaking starts the similarly. If you convert these months into years, means if a child has developed one teeth at the age of 5 or 6 months, his teeth will start breaking. The milk teeth will start breaking one by one at the age of 6 or 7, 5 or 6 years. It's a routine. So at this time, we all know that it's a developing phase. And in this developing phase, everything is developing, and some of the things are coming new into the system for the formation of the body. The same way, fontanelles in our head, we have a time period for that one. It's open. The sutures of the skull bones are still open, and they are they are covered by the cartilages, wherever the bones join each other, and there is a gap because it's a globe. Head, skull is a globe type. Therefore, sometimes a gap remains, and that gap remains in front, and that gap remains in the backside. And so that gap is known as fontanelles, and fontanelles are having are being covered by the cartilages. Means still they are not converted into fully hard bone. That is known as cartilage. And ultimately, there is a specific periods when these fontanelles are converted into hard bone. So it means the progress is still going on. Anterior fontanelle and posterior fontanelles and all these things, because in the occipital there is also some gaps which are covered with hard bone later on, and there is a one fontanelle that is known as frontal, where the parietal bones and the frontal bone of the head meets. There is a gap on the head, so that they are completed in a due course. Means still the progress starts from the first very day when the sperm and ovum meets. And since then, they spent 280 days in the mother's wubs, and now the child has come up out of mother's wub, and still progress is going on. We assume that now the child is complete, but still there are some anomalies, some deficiencies remains which are not completed, and do we say that the anomalies? But after birth, still many things which are structurally formed, which are outlined, but they are not complete. And those which are not complete are having a schedule, having a proper time that these will be completed later on, just like I told you about the fontanelles, and I told you about the teething periods, and ultimately we know about the changes in the heart, because when it was in the mother's wubs, the foramen oval, from right atrium to the left atrium, the blood was going directly there. It was not going to the lungs because lungs were not working at that time. It means whatever mother has blood oxygen, whatever mother has food and blood, the same thing is being supplied to the child in his womb. Fetus in his womb, you can say. The fetus is the exact word for that one. And ultimately, when the child comes out of mother, then that process starts, because blood needs oxygen and blood needs foods. But the connection of a mother has been disconnected now. It means we need the lungs to work normally. So ultimately, it's a nature's process. Many a time I have described you about that one, that process starts with the 480 millimeter pressure of the mercury of our environment, which was not to that fetus when it was in the mother's womb. As he comes out of mother's womb, he bears this pressure, and because of that pressure, the lungs are opened. And not only the lungs open, there are many more other changes which occurs inside the heart as well. So this is also a part of the development, also a part of the development. But in due course, that foramen oval is completed. And if somehow by any reasons that is not completed, then we need sometimes, now the surgery is advanced in this phase, and we need the surgery to develop. But even then, sometimes it may take a longer period to close that foramen oval, because if the foramen oval is not completed, then some of the portion of the deoxygenated blood which is coming from the body will be again mixed up into the fresh blood which is coming from the lungs to the heart. And that will be supplied to the whole body. It means the ratio of the oxygen and also the ratio of the food as well will be decreased, in this blood which is being supplied by the left ventricle of the heart to the whole body. And that shows many of the symptoms we have already described. And when again the period will come about the heart diseases, I will describe all those signs and symptoms that you can assume, you can see from the childrens who are not developing normally, and they are having foramen oval patent foramen oval has different sign and symptoms, and we will describe it later on, though many lectures has been given on this thing. The same way I'm talking about the teethings, and teethings are completed. We assume that teethings are completed up to 25th years of age. Previous 20 milk teeth breaks, and new teeth comes and take the place of the old milk teeth. They are known as permanent teeth, and ultimately some other teeth, extra teeth, come in existence and complete about 32 teeth in each person's mouth. So that depends upon case to case vary it, but we assume it should be just like I told you about that. The milk teeth should be completed in 24 months, means 2 years. The same way we assume that within 24 years all the 32 teeth should be completed, but sometimes within 24 to 25th years of age we see the wisdom teeth. We call it wisdom teeth. Wisdom teeth grows, though it's also a molar teeth. Incisor, canine, premolar, molar. This is the division of these teeth I have already described. Again, when we will come to the this phase, and I will tell you how the incisor teeth are, how many they are number, and how they grow it. Then what's a canine, and when it grows up, what are the premolars and what are the molars, and all that. So the molar teeth, the last molar teeth, these are known as the wisdom teeth. They grow at the age of 24 to 25th years of age. It means the growth of the child was still going on. But after the wisdom teeth grows, means at that time a person becomes sufficiently knowledgeable to run in this world. He understands many of the things of this society, and he works according to that. That is why perhaps its name has been given the wisdom teeth. Otherwise, it was a molar teeth. Its name is a molar teeth. And different teeth, different molar teeth are having different number of roots in the inside. So ultimately, now again, we are confused that we say now the body is complete. Still not. Still not. Many other things, just like the xiphoid process I told you. The xiphoid process is a slit-like process where your ribs are divided, chest and abdomen. They are two portions of the trunk. The upper portion, which is covered by the ribs, is known as chest, and the lower portion after the ribs are completed, that is 24, 12 on one side, 12 on the other side, and the two ribs on both the sides are floating ribs, or the false rib, you can say that. These are the floating ribs. They are not joining in front directly to the sternum, but they are joining in the back side of our vertebral columns. And I'm saying where the seventh rib approximately joins with the sternum. After that, there is a still gap, which is a cartilaginous, a soft bone, you can say. The cartilage is a soft type of bone which is not yet converted into complete hard bones. That is known as xiphoid process of the sternum, or you can say the end of downward bottom portion of the sternum is known as xiphoid process. The upper portion of the sternum is known as manubrium sterni, where our clavicle bones joins, and after that the ribs joins to the sternum, and at the end of that one there is a cartilaginous portion which is known as xiphoid process. No bones joins with that one, and that is a cartilaginous bone. Cartilage. And ultimately, that cartilaginous bone converted into hard bone as we grow older after 55 or 65 years of age. That becomes hard bone at this time. So I'm explaining all these things to let you know that the progress or the development of this body is not completed at any moment of the life. When I say any moment of the life, it means structurally changes, continues growing, coming up in a new phase until the end of the life, and that is covered under the metabolism. Means cells are also developing. Cells are also new formed every 120 days. The new cells are formed. It means development is going on. It means the changes in the bones, the changes in the joints are going on. That's called the epiphysis unions. So it means throughout our life, metabolism is going on, which is accounted for or which indicates the continued development of the body. Means it was not complete. The body was not complete even up to the end of the life. There are still some structure which may be in our knowledge or may not be in our knowledge. Just like I told you, at 60, 65 years of age, Zephyr stop process at the top downward at the end of the sternum, there is a process like a sharp process that is known as a Zephyr process. So it indicates that many of the things continue to grow. They are not completed even until the end of the life. But most of the things we do not know about. And most of the things, if we do not know about, it means we do not know the function of it. That is why we consider this body is a complete body. So ultimately, this was the structural thing I told you, that the structurally this body continue to grow and continue to be completed. Second thing, functionally, that is known as physiologically. Physiologically, most of the things continue to grow in its normal function, continue to grow in its diverted functions, continue to grow in its diseased functions. If it's not normal, it's a diseased. If it's not normal but it's not diseased, it means it's a functional problems. And sometimes the functional problems within a due course they are covered. And for some of the functional problems are converted into gross changes in the tissues, that is known as pathology, and gross changes in the cells, formatting cells of the that organ or the system or anywhere wherever there is a deficiency. So it means physiologically system works normally when it comes from the mother's womb, but still there are some changes which are changed in pattern. Their pattern is changes, like I told you about the heart, and change in structures, and so their function is just like if the fontanelles. If the fontanelle is soft, we medically diagnosed many things from the fontanelles. But when it is converted into hard bone, those things which we were diagnosing from the palpation of the fontanelles, we cannot. Now we cannot do that. So there is some changes. Some beneficially changes, some changes are considered as diseased changes. So many of the things occurs even physiologically after a child is born and developing time to time. So physiologically, also there are many more changes. Then some of the things physiologically, or some of the things you can say socially, affects the human beings. And socially, I told you about the adult age, when a child attains a adult age, which is considered that now he is adult and he is responsible, that he has some responsibility to discharge, and also he is sufficiently intelligent for those duties. But if someone is not capable of doing those duties, it means socially or functionally something is altered inside his or her body. And about that one, I will just go back to the history. I told you, when the ovum and sperms meets each other, and if X, because I will not detail, because I have already detailed that one, how a male child is developing, how female child is developing. That is the pattern of XX and XY, XX chromosomes of the female and XY chromosomes of the males. Whosoever met over there and supervenes, whosoever is meeting and supervening, that is the character, that is the sex of the new coming fetus. So in this way, we have already described you about this thing, but ultimately, I have described you that this changes is not permanent changes. Still, many times there are some changes occurring time to time in the developmental phase of this child. Just like I told you about that one, that at the 20th week of pregnancy, we do the ultrasound. When there was no ultrasound, we do not know what is the sex of the child in the mother's womb. What are the abnormalities in his structural formation of the fetus? We do not know about that one until it is born. And when this child is born, then we realize that he is having this kind of abnormalities, and that he is having and this kind of structural abnormalities, and the child is handicapped even for life now. So these are the conditions I have told you. But I also told you that at 20th week, we now able to have the ultrasound and indicate. We can indicate before that one. I told you at the 13th week of the pregnancy, even 13 and a half, before 14th week, we are able to diagnose the things at this time, that if the child is not developing normally, if the fetus is the exact. First of all, its name was embryo, and after that, it was after you can say the 3 months. Its name is changed. 12 weeks. Its name is changed. It's known as fetus after that till it is born. So in this way, the we are now able to the fetal stage. In the beginning of the fetal stage, now we are able to diagnose the abnormality of the developing fetus in the mother's womb. We have techniques now. And if we have the techniques, we have means to correct that one as far as it is possible under the approach of the medical science. And even by surgery, even during mother's wombs, I have seen many literatures about this one, that even the surgery has been done in the mother's wombs, and again it was enclosed into the mother's womb, and the child developed in a normal phase, and ultimately he was not having that problem when he born. In this way, so many changes continue to develop. Many abnormalities continue to come into the normal phase. And it happens that at 20th week of pregnancy, we detect those things, and we detect the sex as well, that this is the sex of the child, male or female. Once it was done when the ovum and sperm was meeting, and we are unable to diagnose at that time. Ultimately, there are some measures The old Ayurvedic means are adopting that put some drops of pregnant females' milk into the water. If that water floats, it indicates it's not hard and fast. Don't take it granted, because I'm not saying that granted, but this is what's going on in our society. That if that drop of milk of the pregnant woman floats over water, indicates the female child, and if it sinks down into the water, it is considered as the male child. And some of the other measures are adopting now. It is measures. First of all, the pregnancy is diagnosed by testing the urine. Pregnancy is tested by the testing of the saliva, and even to some extent, many of the triple X problems are also detected from the saliva as well. So many of the abnormalities we are now able to detect in the fetus when it is in the mother's womb. So in this way, when the child comes out, we consider it that it is a normal, but still many things are going on. And the main thing for which I go back to describe you, that the sex of the child, it was a very controversial stage when a doctor says to the family that the woman has a male child in her womb, and ultimately when it borns, this is done at 20th week as per the law is concerned. But this test is now controlled by law, that you cannot determine the sex, but it is only for the detection of the diseases, for the diagnosis of the abnormalities of the child. Even then, we come to know that the sex of the fetus is this one, male or females. So ultimately, at 20th week, many of the peoples come to know, many of the doctors comes to know that what is the sex of the fetus in the mother's verbs. But when it borns at 40 weeks or 40 weeks of pregnancy, means 280 days, it's just reverse to that one. We declared at 20th week, it's a male child. When it borns, it may be a female child. It happens because I told you the whole story, that the fight between the X chromosomes and the Y chromosomes is still going on. And that is why they are changing patterns, male and females. So, in this way, previously it was a medical legal questions, medical legal complications were arising, that people were saying that first of all you give us an ultrasound report that it is the male child, but now you are giving us a girl. Our child has been changed. But nowadays, with the development of the DNA, we are to some extent, to most of the extents, sure that yes, it is your child, because now we know the genetics, that that fight of the X chromosomes and the Y chromosomes is still going on. That is why it is happens. And I'm going back because of this one. I want to convey you that at the age of adult, when a child is going to be adult, when a child is passing through the adolescence age, because we have divided the age, mother's life in the mother's womb, life of the after mother's womb, that's newborn. After that, it's a toddlers, and toddlers is up to 5 years. Newborn is up to 1 year. Toddler is up to 5 years. And after that, a age starts, which is known as adolescence. And this body of the child continue to grow every day, continue to grow, to develop structurally and functionally as well. And ultimately, a stage comes, then you might have heard about that, because now the world has become a global village. It's not that you do not know what's going on in the next village. No. Now the media is so strong, and anything happens in any corner of the world, you come to know at the second moment. And that is why these kind of happenings, that a girl is converting into male child and a male is converting into female childs, are not unknown. These are known news we heard every day. And first of all, it was controversial when it was born, because we were told something else and it born something else. And that question was solved, that problem was solved by the DNA to some extent. I told about that DNA also, that it can, you can say, minus those who are not the parents, but it cannot determine that this is the parent, this is the father. There is some difference in saying this one, that if the controversial thing comes into two or three paternity problems, and at that conditions, medical science, by detecting the DNA, can come to know that these persons are not the father of this child. So, just for example, there were five or six women were admitted for the delivery, and delivery has taken place at the same time. How many deliveries have taken place at the same time? Three or four, or one or two, whatever it is. And it is very easy to detect from any hospital if this thing arises, that we can detect that yes, it is your child, because it's matching the DNA, not with anyone, but with you. So, in this way, we come to the conclusion that it is your child. It's not mix up or anything else. So, ultimately, I'm talking about the adolescence age, when a child reaches up to the adolescence age, which is up to the 14 years of age. And you might have heard about this thing, that a girl child is converted into male child, or a male child is converted into a girl child, with little help of the medical science. All these structures are changing, and these changes are depending relatively on the hormonal change which is going on inside their body. Testosterone hormone is responsible to produce the characteristics of the male child. Progesterone, estrogen hormones are responsible for producing the characteristic of a female child. So this fight was going on of the chromosomes inside his body. First of all, it was in his body, but when he was in the mother's womb, after that he born, and it was something changed. And now there's no question, because our child is developing in front of us. We know it's a male child, or we know it's a female child, and if it is converted into a male to female, or female to male child, we know that it's nothing mixing. It's first of all, we were considering nature's magic, but we do not believe in magics. Everything is going on systematically. Everything has a reason being in the back of that one. Without reason, nothing is happening in this world. There are some reasons for any happening inside the world, and there are reasons behind that at the adolescence age, when a child is converted into the other sex. And in this way, we know that is all, it happens because of the hormones, but it all hormones are converted in a different shape because of the genetic character, because of the X and Y chromosomes. And this happens at that stage. I told you about that one, that this stage comes when a child is attaining the adolescence age. He is not still fully developed young man. He is not fully, you can consider him a child. At that phase is considered as after 6 years of age, because up to 5, up to 1 years, it was a newborn. From 1 to 5 years, it was a toddlers. After 5 to means 6 to 14 years, it's a toddler's age. It's adolescence age. Adolescence age means when their secondary sex character starts developing, when everything is coming to the definite shape that this is a child, a female child, that this is the male child. Yeah, he's a boy, he's a girl. When they are representing a definite structures, and not only the structure, their definite functioning, which indicates that this is a female child, this is a male child. Just like in females, change of voice, softness, development of breast, development of all body structures into little fatty, more fat is absorbed, and also the development of menstruations. And with all these menstruations and this development of the hormones, eating habit, desire aversions, everything changed. And the same way in the male child, because of the testosterone hormone, but not because of testosterone hormone, it's all because of the genetic character coming from the back and changing pattern, overpowering. And the child is converted from female to male at this time, and he developed the secondary sex characters, which are known as the mostiches, which are considered to stout body, masculine bodies, less fat as compared to the female child, less fat. Female child is having more fat, development of the breast, but in the case of the male child, there is no development of the breast. Voice changes too hard. It's adolescence age. The voice changes to a hard voice as compared to the soft voice of the females. In this way, there is no menstruation, but there is production of the semen. All these things happens, changes continues to develop. And I'm talking about the changes which occurs in the fetus and in the different stages of the life. And we are at the age that is known as adolescence age, and now the child is developing to the adult age. At that time, when he is crossing the 14 years of age, since then, whatever has happened, now whatever has happened, whether a female child is converted into male child or a male child is converted into female child, whatever is, after that, age starts when the parents starts thinking that we should look for a male boy for our girl, we should look for female child for our male child boy, or for the boy for our female childs differently. Whatever at this time, sex has been determined that after even the conversions, parents think on these lines that we have to think partner for him, because all these secondary sex characters are developing. It's a but natural. We our mentally status is that we understand that at the age of adult, uh, the normal life, what's the function of the life? The function of the life, main function is to develop life from life. And now our child is at the age that he's able to, with the secondary sex characters, he's able to develop life from life. And then we think on these lines that girls should be married to a boy, or boy should be married to a girl, and we look for that one. As parents, we look for that. But ultimately, one stage comes again. You will be astonished about this one. I have already told about this one in my previous lecture, but because I have to start the new chapters, so I am sum up all these things from the back sides that again, astonished things happen, and we are confused. Parents are confused that we are thinking that we are looking for a boy for our adult girl, And the girl says, no, I have no interest in males. I want to marry with a female. Lesbian character. By law, we consider the lesbian is illegal. I'm commenting on that points. And on the other hand, a male child thinks that I'm not interested in the females. I'm interested in the males. I will get married to a male. Though functionally, structurally, they belongs to male or female structures, and for the procreations, for the development of new life, they should choose the pattern or partner of the other sex. But they are choosing controversial things, and the parents are at this time stunned about this thing, what to do about this thing. I was thinking to get my girl married. I was thinking to get my son married, and they are thinking just reverse, just opposite to the environment our society thoughts. In this way, though legally it is considered wrong by law, lesbian relations or the male homosexual relations, sodomy, and all those things are illegal by law. But nowadays, with the development of the genetic study, it has come to the knowledge that it is not illegal, because it is not because that he wants this thing. It is because the genetically something has occupied in a male child. The characteristic has been occupied by a opposite sex. He should crave for the female. The male child should crave for the female, the opposite sex, just like the magnet, north pole, south poles. And the female should crave for a male child. And here it is just reverse to that one. We are unable to swallow this thing. We are unable to think on these lines. But this is still the study of the genetics, which shows us that this kind of happening is also a natural development because of the genetic characters. Because of the genetic development is still going on at this age, just like I told you, the Z4 process at the age of 65 or 60 years of age, the Z4 process is converted into bone. The same way, this is still the development. It means up to death of a person, this body is continuing for the development structurally and also physiologically, functionally and structurally. This body continues to develop, continue to change, you can say. And this is the critical conditions at this time, when the parents were thinking on the different lines, and the child having the different mentality. Physically, they are performing the physiological function normally. A girl is menstruating normally. A girl has development of breast and soft voice and everything. Whatever the secondary sex characters of the female should be, she is having that. The same way, a male child is having testes, a male child is having mustaches, a male child is having hard voice, a male child having masculine bodies, a male child is having semen developments, spermatozoa development. Everything is there, but mentality is different. It means still that fight of the genes, X chromosomes, Y chromosomes, is still going on. Fight is still going on, and one of the chromosome is occupying the physical status, and he is developing as a male child, male adult child. And some of the other other chromosomes is occupying the mentality. and he is not interested in that one. Ultimately, in our other physiological functions, sometimes why we crave for different things, that depends upon the our thyroid hormones, which maintain the metabolic rates. We crave for sweets, we crave for salts, we crave for unusual things. This is also a craving type of things, but it is all because of the genetic character. Genetic character they attained from birth since their beginning, and they were fighting with each other. And now it is the stage, and the critical position of the parents is that sometimes the child do not speak their will, they are unable to. And ultimately some of the couples, male or female, or sometimes they get married, the parents get the marriage, and ultimately they divorce. Ultimately the condition comes up that they cannot satisfy their partner, though they are able to procreations, they are able to produce the children, but even then they do not like this type of relationships. And this condition happens in front of parents, and parents are stunned from these conditions. This is what's going on at this world. Many of the I think most of the stage country, I can talk about the America, just like in California and most of the states, they are giving the status to them that yes, if you are interested to get married with the male child, with the same sex marriage, you are allowed to. If you are a girl and you want to get married to the same sex, and though legally it was lesbian under act, it's wrong. Though it's a male marriage from the male to male is a wrong by law, even then it's okay. Our politicians, they are after the voting. They are after the voting system, and they forget the natural principle. Plus, nowadays it has become verified by the nature that it is not their fault. It is not their fault. It is because of the genetic character, and one genetic character has occupied the brain, though the physically it has occupied by the other one, and it is developing as a male child, but the thinking is about the female, and female will not look for the male, and for the females they will look for the male. Structurally male is looking for the male child because the mentality is occupied by the opposite sex. So these type of conditions nowadays we are seeing in all these societies in many countries, and our India. Yes, we were thinking that it is against the religions, it is against the society, it is against the law, everything. It will not be allowed at any cost. But even then, these things are happening in India as well. We listen to the news every day that a girl is getting married with the girls, boy is getting married with the boys. And these things are patronized by the religion as well. Many examples, and many medias are producing the pictures of those things, and they are recognizing it. And controversy is going on, no problem. Controversy about these things is going on, but still it is going on in the society in a large number at this time. California has already permitted this one, but now Mr. Trump, he says that no, there is only two sex, male or female sex. By natures, they are male and female sex. There's no third transgender, or there, because most of the peoples nowadays, with the achievement of the medical science, they are converting their sexes. Medical science is helping to the mental faculty that if you are being girl, are not interested in males, it means we can change inside your body and you will be permitted to that one. And some of them are changing the sex physically. and they are matching their mentality, and medical science is helping them. The same when the male childs, they are also changing the sex, becoming the females, and because their mentality is different, and then they will marry to the male child again. Physically, they were male. Transgender system has been developed, and it is recognized a large in many of the countries that there is a transgender also, male, female, and transgenders. This fight is going on. But apart from that, apart from that one, I will start teaching you all that this structure has formed, because every male has a head, every female has a head. I'm not talking about the functioning things, but I'm talking about the structural things. Those structural things are having some of the diseases common to that. Structures are similar, but their function is different. Whatever they produce is different. Whatever they express is different, but their structure is a similar type of things outwardly. And I will describe from now onward all these things, that what type of head is formed, what type of structures are inside that one, and what type of diseases they can occupy, and what will be the sign and symptoms of those diseases, so that I can help that person who is having some type of diseases, that they may be cured with the medical science, with the help of the medicines. So this is our today's lecture, and from now onward, this lecture will be in Punjabi and then in Hindi, and after that I will start this the regular lecture of structural formation of head and their diseases as well. God bless you all. I am your host Gurdeep Singh Sandhu, homeopathy consultant, and my clinic address is 9701 Sarah and Court, Dublin, California 94568. Anytime. If you are suffering from any disease at any age and you want to get opinion, second opinion, or you are tired of any treatments, you want to be taken by homeopathic system of treatments, please call me at 408 687 1899. There is no consultation fee, and I will consult your case. I can advise you. It's not necessary that you will take treatment from me, but I can advise you for the best interest of the society, what I can do, what I can offer to the society, and I will advise you to the best of my knowledge, depending upon my 52 years of experience in medical practice. So please call 408 687 1899. And second thing, I will request all of you that if you think these lectures are some beneficial and your knowledge is increasing, these are benefit to you and to the society as well. You can tell these other peoples, your nearest and the dearest, so that they can listen these lectures and they can be benefited also. So please convey this message to the masses, to the nearest and dearest, so that they can join my Facebook media, also the YouTube media, homeopathic medicines, and our Sabarang radio station, so that they can listen from Sabarang radio stations, and they can download their app on their iPhones and Android phones, and they can listen all these things, lectures, when they are traveling, when they're going in their cars and all that. And they can listen all the lectures and all the programs which are going on in the Sabarang radio stations anywhere all over the world. And the second thing about this Facebook and YouTube, and if ever you want to just connected with the medical science and the knowledge about your body and health and sickness and cure, yes, you can join my YouTube channel as well, and you can get knowledge whenever next lecture is due. Every day I deliver my lecture at 5 to 6 p.m. California Pacific Standard Time. And the Facebook, yes, I welcome to all those who are listening these lectures that they want to be connected with me on Facebook media as a friend. They can send me their request, but my request is that whenever you send me request for your friendship, please complete your profile so that I should understand that to whom I am connecting with my friend list, and he's coming in, who is he, and what he's doing, all these things about you as a friend. I want to know about that things. So God bless you all. We'll see you tomorrow in Punjabi lectures, and from the same time 5 to 6 p.m. Rab Rakha. Thank you.